Dr. I'm going to be doing an assessment for advanced health assessment. We're going to be doing the head and neck, the eyes, ears, nose, and throat. Our patient is a 7-year-old female patient, happens to be my daughter. First, we're going to look at our head and neck. We're going to start with the inspection of the head, face, and position of the neck. The patient should be sitting straight with her head without any turns or tremors. We're going to look at her face, make sure it's symmetrical with no tics or any other unusual features. We're going to palpate the head in 5 areas. We're going to go to the skull, we're going to look at the hair, we're going to check the temporal arteries, the temporomandibular joint, and the salivary glands. So we'll go ahead and start with just looking at the skull from front to back. While we're doing that, we can also go through the hair, look at the scalp, see if there's any lesions, nits, or other abnormalities. Okay, I do appreciate a little small area in the back which is flattened and somewhat soft, but the sutures are well approximated together. I know that this particular thing happens to be a genetic thing, and it is no problem with this patient. We're going to continue to check the temporal arteries. I'm not going to auscultate them because I'm not concerned with arteriitis, but if we did, it would be an auscultation here. We would also auscultate on the occipital region, listening for any kind of bruit there, which would suggest any kind of abnormalities in the vasculature of the head. We can go ahead and percuss the skull. It should be in low-pitched tone, or it should not be a low-pitched tone. If it was, we would be concerned with hyperparathyroidism. Again, we can auscultate the temporal regions. We're just making sure that there's no bruise. Okay, we'll examine the neck. We'll start with the inspection of the neck and make sure that if you can put your head and look up toward the ceiling. With a hyperextension, we're going to look at 6 characteristics. Can you swallow for me? Very good. Make sure that the trachea is aligned, and we can look at the side of the neck when she's swallowing and make sure that the thyroid moves. Also, we're going to palpate the neck after that. Can you look all the way to the ceiling? Now look all the way to the floor. Good. Turn your head towards me and turn your head the other direction. Good. Does that hurt at all? Okay. We're testing your range of motion and muscle strength. Go ahead and turn your head that way again. Good. Now turn it to the right. All right. Strength of muscles is within normal limits. We're going to palpate the trachea. Put our thumb along each side and compare the space. Okay, I'm feeling for the hyoid bone and thyroid and cricoid cartridges. They're smooth and they're non-tender. And if you will put your head up, and can you swallow for me? Okay, she doesn't have any tracheal tug, so I'm not concerned with any sort of aortic aneurysms. We're going to go ahead and inspect and palpate the lymph nodes on the neck and the back. We search to make sure that there's no swelling or abnormalities or any nodules on those lymph nodes, and they all feel within normal limits. We're going to inspect the thyroid gland. I'm going to go ahead and get a cup of water for the patient. This water, while the patient drinks, we're going to look at the thyroid to make sure it moves, and I will palpate it as she drinks. Okay, here's what I want you to do, Ellie. Can you kind of look up a little bit and drink a little water? Okay, the thyroid is about 2 centimeters. I can feel both lobes. One more time, please. It is soft, not a little spongy. I don't feel any sort of nodules, nodes. Also, by looking at the bottom portion of the neck, it doesn't look swollen. There is no fat fold at that area. Again, I did the rear approach on that. And if the thyroid was enlarged, I could auscultate for bruits, make sure that there was no problem with that thyroid. Next, we're going to move to the eyes. I don't have a Snellen chart, but this patient could use an E-Snellen chart because she is 8 years old. I also do not have a Jaeger near vision card, so we're going to go ahead and dispense with those, although I had that done in the clinic and she did have normal vision. So we will dispense with the distant and near vision. We'll go ahead and try the peripheral vision using the confrontation test. Can you cover your right eye with your hand? Right. With this hand, please.
I can't.
There you go. Good job. Now, I'm going to look at you. I want you to look right at my face. I want you to tell me when you see my fingers.
See your fingers.
Okay. Cover your hand with your left eye. Look right at me. There you go.
See your fingers.
Good. Well, we went ahead and did the peripheral vision test. That's the peripheral. We can test the nasal, temporal, superior, and inferior fields as well. But due to lack of time on this assessment, we're going to dispense with that too. We are not going to test the color vision. I don't have any color plates. If I was concerned about any sort of color blindness, we would get some color plates and test that. We're going to do an external examination of the eye. We're going to look at the eye itself and surrounding structures, the eyebrows for size extension, make sure that that they do not extend beyond the lateral aspect of the eye, and check the orbital area for edema, puffiness, sagginess. Make sure that there are no masses there. Okay, just relax your eye for me. I'm going to look at her eyelid, make sure that there's no lesions in there, that the lacrimal sac is not swollen. We'll look at her eyes if you'll close your eyes for me. No tremors. Not, again, worried about hyperparathyroidism. That's not a problem here. Can you open your eyes really wide? Really wide. No, just look at me. Now close them. Open them really big. Look up here. Follow my finger. Good. Only with your eyes. Only with your eyes. There you go. In. Good. We're doing the common thing. The Perla, she does have visual movement normal within all fields with no nystagmus lateral or vertical. She does have good accommodation as she's followed my finger in. And we are going to check and make sure she does not have any ptosis. Her eyes are within normal range here. Her eyelids are not everged or inversed. And we didn't see any crusting raised eye. The eyelids do meet completely. Once again, close your eyes. Good job. Okay. While I was looking, we looked at the conjunctiva. Okay, open your eyes and look at the ceiling. Not yellow. And the sclera are not jaundiced either. We're not going to do any kind of test for foreign bodies at this time. I don't see any erythema, exudates. I don't see any hemorrhages there. We're going to look at the cornea in two different ways. First, we're going to check it for clarity. Go ahead and look straight ahead for me. Good. And by checking the eye with the light to the side, look straight ahead. Don't look at me. Look at my finger. Good. Okay. The cornea is not clouded. We don't see any color circles. We're going to go ahead and check the sensitivity of the cornea. Ellie, I'm going to have you look straight ahead and open your eyes. As you can see, the blink is present. Next, we're going to check the iris and pupil. The iris is visible. I'm going to turn on the light here. Look right at me. Good. The pupil is about 2 millimeters and round. We're going to go ahead and do a response to light. It's not too dark in here, but look at me. We're checking people on the right and then checking the reflex on the left. And then we check the people on the left with the reflex on the right. It is brisk and reactive. We're going to do the swinging flashlight test. We'll shine that light in one eye and then shine it to the other eye. If the second eye is dilated or out of constriction, then we'll have a problem there. So look at me real quick. Good, good. And that is normal. We went ahead and did accommodation already. The lens, from what we said, was actually transparent. The extraocular muscles, we evaluated the eye movement. We did the 6 cardinal fields of gaze already. followed my finger. And then we're finally going to use our ophthalmoscope. The way we want to do that is, we'll dim the light, I'll check the right eye. With the right eye, I'm going to be using my right hand. Actually, her left eye, but it'll be right for me. We're going to check to make sure. We're looking for the optic disc, and we're also looking at the retina. And sometimes it's difficult to see, but we're following the blood vessels out, the retina. Good. Let's go to the other side, and I'll finish talking about that after I finish looking. Okay. Okay, what we have looked at is we visualize the structure. I visualized the red reflex. I did look at the retina. It was slightly reddish pink, and it didn't have any light or dark areas. And I really didn't see a whole lot of the retina, but I did have to follow up using the blood vessels. And as we've talked about in the past, they do branch away from the optic disc. I didn't see any pulsations or any unusual branchings of the retina vessels. I didn't see any hemorrhage as well. The optic disc was kind of yellow to a little creamy pink. It's really small, probably about 1 to 1.25 millimeters in diameter, and the macula was a little bit brighter, and it was surrounded by some areas that didn't look like they had as many vessels on them. Okay, that is the completion of the head and neck and the eyes. Our last assessments will be going to the ears, nose, and throat. Okay, and we're going to look at the external ear canal and make sure that placement will draw like an XY axis. Make sure that it is not, that the ear is not below the level of the eye. And we're checking the auricles for the size, symmetry, any kind of unusual growths or color, and make sure we always check the back and underneath as well. There are times that, especially in older folks, that skin cancer can develop in the back of the ear, that it won't be seen if we don't look for it. We'll check the external auditory canal, make sure there's no discharge, color, or unusual things. We go ahead and grab a covering that is as large as possible to fit inside her ear. We're going to look at the auditory canal with this, and also going to look at the tympanic membrane. The ear is pulled up and back. I'm visualizing a pearly gray tympanic membrane. I can see the inner ear bones, and it appears to be slightly shiny and somewhat conical. I don't have a pneumatic otoscope, so I can't puff on the eardrum to see if it reacts. But no, this patient's history, she had a medical exam not too long ago, and they did that, and it was fine. We're going to evaluate the hearing, which is cranial nerve 8 in 4 ways. We're going to start just noticing how she talks, how she looks at us, and how she listens when we talk. And her hearing actually has been evaluated as well, and it's within normal limits. Okay, the next thing we'll whisper in her each ear, and she should be able to hear 3 out of my 6 words. Okay, look straight ahead. I'm going to whisper in your ear. I want you to tell me what I said.
My mother is beautiful.
Very good.
My sister is smart.
Very good. And that was a very soft whisper. We're going to perform the Weber test, but I don't have a vibrating tuning fork, so we can't do that. We also can't do the Rin test. We'll move on to the nose. We'll look at the any kind of deviations in the nose, size, shape. If it looks within normal limits, I'm going to check the septum to make sure it's not deviated as well. And the bridge and soft tissues of the nose. No masses, no displacement. The cartilage feels within normal limits. Can you blow through your nose? Good. Next side. Excellent. Nasal cavity is going to be checked next. That was the nasal patency. It is normal in the nasal cavity. We do not have a speculum. I'm going to go ahead and use the otoscope with a different cover. We're looking for the nasal mucosa, which should be deep pink and glistening. And it is. The septum again is midline. The turbinates are not swollen. We're not going to be able to do a sense of smell today. We're going to look at the front maxillary and maxillary sinuses. We'll press my thumbs up under the bones each side of the nose. And the maxillary sinuses, any kind of swelling and tenderness, pain. Does that hurt when I tap you? Good. All right. And she does not have any problems with her sinuses. We're going to look at the mouth, oral cavity, and oral pharynx next. Look at the lips for color, symmetry. Give me a smile. Good. Also, while we do this, we can also make sure that there's no droop. We'll look at her teeth for any kind of occlusion. Can you open your mouth for me? Good. Now close it. Her teeth are relatively straight. However, she is in the midst of having some adult teeth come through, so the front teeth are rather loose. I'm going to need a light. We're going to look at the buccal mucosa, gums, and teeth. And we'll do this in 4 different ways. First, we're going to look at the mucous membrane. Open up for me. Good. Looking for any lesions. Since you're my daughter, I will put my finger in your mouth. Otherwise, I would have probably used gloves. Okay, looking at the hard and soft palate. Make sure that there's no induration, thickening, or masses. Again, we looked at the teeth. We looked at the gums. Gums looks like she has some pre-eruptions of molars on the bottom and on the top, but the gums are pink. There is no redness or swelling in that area. Next, we're going to look at the tongue. Can you stick out your tongue at me and just relax it? Good. I'm going to touch it and look at it. There is no whiteness. There's no cracks, no fissures on the tongue. Open up your mouth really big. Good. Look underneath the tongue. Okay, one more time. The hypoglossal, no hypoglossal tumors. I don't appreciate anything in the mouth that would show any kind of abnormal colors or masses. We looked at the palate and the uvula at that time. Finally, we're going to go and look at the oral pharynx. We're going to look at it 3 ways. We're going to look at the tonsillar pillars, the tonsils, and the posterior wall of the pharynx. And while we do this, I'm also going to stick your tongue way out for me. Good. No, that's fine. Okay, stick it way out. I won't touch it there. This patient is a little sensitive to the gag, which I didn't really have to test for it. Move the tongue blade back very far to test. I could do a nylon Barrenberry test, which evaluates the vestibular branch of the cranial nerves, but I'm not going to do that. One last thing, since we were in the mouth, I'm going to palpate the parotid glands and salivary glands. Can you open up for me? Good. Can you open and close? Good. There's no, the tibulomandibular joint doesn't have any cracks or clicks or anything. And that is our assessment. Thank you very much. We will see you next week.